In this section just deals only 25 give reasons from dialysis. The first question, heparin is administered during hemodialysis. Heparin prevents clotting in the extracorporeal circuit during dialysis. The second question, protein intake is moderate in dialysis patient. Protein intake is limited in CKD, chronic kidney disease patient, but during the dialysis, moderate protein is needed to replace the loss. So 1 to 1.5 gram per kg per day of protein encouraged. The fistula site must not be used for blood pressure or IV insertion. This prevents trauma, infection or thrombosis of AV fistula. A bruit or thrill should be assessed at AV fistula site. The presence of bruit by auscultation and thrill by palpation indicate proper blood flow and patency. This is the one of the method for assessing the patency of fistula site 2. The patients are weighted before and after the hemodialysis. Weight change reflects fluid removal and helps determining the ultrafiltration volume too. The patients are advised to strict fluid intake between the dialysis section to prevent fluid overload and hypertension between the treatment. If the fluid overload occurs, definitely the patient may go to pulmonary edema. Electrolytes like potassium are monitored closely in hemodialysis patient. Potassium level can rise. That condition is called it as hyperkalemia. So hyperkalemia is dangerously increased in the case of renal failure that will lead to cardiac problems. The dialysis patients often experience fatigue after the section. Fatigue is common due to fluid and electrolyte shift and removal of toxins. Erythropoietin is administered or prescribed to dialysis patient is because the kidney can't produce erythropoietin, so synthetic erythropoietin is need to correct anemia. Dialysate must be warmed before infusion in peritoneal dialysis. Warm solution prevents discomfort, cramps and maintaining normal body temperature. Protein loss is higher in peritoneal dialysis than in hemodialysis. Protein are lost through the peritoneal membrane with each exchange. The patient with cloudy, foul-smelling peritoneal fluid must be evaluated immediately. That indicate peritonitis and is a serious and also require immediate or urgent treatment too. Calcium level are often low in chronic kidney disease patient on dialysis. Due to decreased vitamin D activation and phosphorus retention, the calcium level may often low. High potassium foods are restricted in dialysis patient to prevent hyperkalemia. Hyperkalemia can cause fatal cardiac arrhythmias. Magnesium may accumulate in patients not on dialysis. Magnesium may accumulate in CKD patient not on dialysis. CKD reduces the magnesium excretion, leads to increased magnesium level in the blood. Rapid correction of electrolytes during the dialysis can cause muscle cramps. Rapid shift in the sodium and fluid balance can cause cramps and hypotension. Phosphorus accumulates in the renal failure, requires dietary restriction. It's due to kidney can't excrete phosphorus. So the kidney can't excrete phosphorus, that leads to increased level of phosphorus in the blood. So that will leads to or that cause bone and vascular problem. That's why the kidney patients have decreased calcium level. If the phosphorus is increasing, definitely the calcium may decreasing. So that's why the CKD patient often experiencing fractures. Patient with chronic kidney disease commonly develops metabolic acidosis. It's nothing but kidney fails to excrete hydrogen ions and reabsorb bicarbonate. Kidney fails to excrete hydrogen ion and also fails to reabsorb bicarbonate too. Dialysis helps correct metabolic acidosis. Dialysate contains bicarbonate that neutralize the acids in the blood. Metabolic acidosis contributes to bone demineralization in dialysis patients. Acid-base imbalance causes calcium to leach from the bone. That condition is called it as renal osteodystrophy. Metabolic acidosis can lead to small respirations in dialysis patients. Deep, rapid breathing is a compensatory response to acidosis. Delayed or missed dialysis increases the risk of acidosis. Waste and acid accumulates or accumulation worsen when dialysis is missed. Overcorrection of acidosis during the dialysis can cause metabolic alkalosis. Excess bicarbonate in dialysate can shift pH to alkalosis. And also one more question is, the frequent vomiting in dialysis patient may lead to metabolic alkalosis. Vomiting can cause loss of gastric pH, the gastric acid, that means the H plus ion, that will lead to alkalosis.